Welcome to this module on ethical decision-making frameworks in counseling. In this session, we will explore the foundational role of ethics in counseling psychology, the importance of adhering to professional codes of conduct, and the step-by-step frameworks counselors use to resolve ethical dilemmas. By the end of this video, you will be equipped to identify, analyze, and respond to ethical challenges in your counseling practice, with a special focus on cultural competence and client well-being. Why ethics matter in counseling? Ethics are the backbone of professional counseling. They guide how counselors navigate complex scenarios, build trust with clients, and uphold the integrity of the profession. Ethical practice ensures that counselors act in the best interests of their clients, maintain confidentiality, and provide competent, culturally sensitive care. Adhering to ethical standards is not just about following rules. It's about fostering trust, safety, and respect in every client interaction. Professional codes of ethics. Several professional organizations provide ethical codes that serve as the foundation for ethical decision-making in counseling. American Psychological Association, APA, American Counseling Association, ACA, National Association of Social Workers, NASW, Credentialed Alcohol and Substance Abuse Counselor, CASAC. These codes outline core values, principles, and standards for professional conduct. They address issues such as confidentiality, dual relationships, informed consent, and cultural competence. When faced with ethical dilemmas, counselors are expected to consult these codes to guide their actions. Common ethical dilemmas in counseling. Counselors frequently encounter ethical dilemmas, such as balancing client confidentiality with the duty to warn or protect others, managing dual relationships or conflicts of interest, navigating cultural differences and respecting client autonomy, addressing issues of competence and professional boundaries. Recognizing these dilemmas is the first step toward ethical resolution. The ethical decision-making framework. Step by step, let's break down a widely used ethical decision-making framework into clear, actionable steps. You will use this framework in your case study analysis and discussion board activities. 1. Identify the ethical dilemma. Recognize that a dilemma exists, often when there is a conflict between ethical principles or between ethics and legal requirements. Gather relevant information. Understand the context, the people involved, and the specific details of the situation. Identify stakeholders. Who is affected by the decision? Consider the client, counselor, and any third party. 2. Consult ethical codes and guidelines. Refer to the relevant codes of ethics, APA, ACA, NASW, CASAC. Identify which ethical principles and standards apply to the situation. Consider legal requirements and organizational policies as well. 3. Consider cultural and contextual factors. Assess how cultural, social, or contextual factors might influence the dilemma. Reflect on your own cultural biases and how they may impact your decision-making. Strive for cultural competence and humility, respecting the client's background, values, and worldview. 4. Generate and evaluate potential courses of action. Brainstorm possible actions you could take. For each option, consider the potential benefits and harms for all stakeholders, how each action aligns with ethical principles such as autonomy, beneficence, non-maleficence, justice, fidelity, and veracity, the short and long-term consequences of each choice. 5. Consultation and collaboration. Seek input from colleagues, supervisors, or ethics committees. Consultation provides additional perspectives, helps clarify the dilemma, and supports sound decision-making. 6. Make a decision and take action. Choose the course of action that best aligns with ethical principles, professional codes, and the well-being of all involved. Document your decision-making process and rationale. 7. Reflect and evaluate the outcome. After implementing your decision, reflect on the outcome. Was the issue resolved ethically and effectively? What can you learn from this experience to inform future practice? Adjust your approach as needed for continuous ethical growth. The role of cultural considerations. Cultural competence is not a one-time achievement, but an ongoing process. Ethical decision-making frameworks increasingly emphasize the need to integrate cultural factors at every step. This means being aware of your own cultural assumptions, seeking to understand the client's cultural context, consulting with culturally knowledgeable colleagues when needed, adapting interventions to be culturally appropriate. Cultural humility, an attitude of openness and lifelong learning, is essential for ethical and effective counseling. Practical example: applying the framework. Let's briefly consider a practical scenario. A counselor learns that a teenage client is engaging in risky behavior. The client asks the counselor not to tell their parents. The counselor must balance the ethical duty to maintain confidentiality with the responsibility to protect the client from harm. Applying the framework. Identify the dilemma: confidentiality versus duty to protect. Consult ethical codes, ACA and APA codes on confidentiality and exceptions. Consider cultural factors, family dynamics, cultural views on privacy and authority. Evaluate options: maintain confidentiality, break confidentiality, or seek a compromise. Consult. Discuss with a supervisor or ethics committee. Decide and act. Choose the most ethical course, document the process. Reflect. Assess the outcome and learn from the experience. Best practices for ethical decision-making. Stay informed. Regularly review ethical codes and participate in continuing education. Engage in supervision and consultation. Don't make tough decisions in isolation. Document thoroughly. Keep clear records of your decision-making process. Prioritize client welfare and cultural competence. Always center the client's well-being and respect for diversity. Summary: in this video, we have reviewed the importance of ethics in counseling, introduced key professional codes of ethics, outlined a step-by-step ethical decision-making framework, emphasized the importance of cultural considerations, provided a practical example of applying the framework. As you move forward, take notes on this framework. You will use it in your case study analysis and discussion board activities. Remember, ethical decision-making is a skill that grows with practice, reflection, and a commitment to lifelong learning. Next steps: review the ethical codes from APA, ACA, NASW, and CASAC. Practice applying the decision-making framework to case studies. Participate in the discussion board to share your insights and learn from your peers. Thank you for engaging with this essential topic. Your commitment to ethical practice is vital to the integrity and effectiveness of the counseling profession.